allocations are quite extensive. We are also looking at the improvement of our central mix stores where we store and distribute from. For the 2024-25, 2 million, but by the 2026-2027 financial year, we are looking at a figure of about 80 million. So we are also going to renovate the Etegameno Rehabilitation Center, 9 million, 10 million, and $12 million for the respective financial years of the medium-term expenditure framework.
Mr. Nangombe, it sounds like a very exciting financial year ahead for the Ministry of Health. We know that consideration has also been made for the recruitment of personnel as well as the acquisition of pharmaceuticals and medical supplies. Just talk to us about that particular aspect here.
Yes, I said money is not everything. We need to have the human resources. We need to have the feet on the ground for these individuals to be able to do their work. We do have vacancies that we have identified in November and December last year. The divisions for human resources in the ministry convened in Ochivarongo for about 3 weeks, and they came back to Windhoek for another 2 weeks to identify all the vacancies in the ministry in order to also identify those vacancies that we can abolish and create new ones through what is known as compensatory reduction. For the 2024-25 financial year, we look forward to recruiting about 2,200 healthcare workers, and over the medium-term expenditure framework, we are looking at recruiting more than 6,000 personnel to help us improve our public healthcare system. With respect to the acquisition of pharmaceuticals, we are looking at a figure of more than $1.8 billion, almost $2 billion to acquire pharmaceuticals and clinical supplies. But we also believe that prevention is better than cure. Good health must not start in hospitals. So we are also encouraging individuals and Namibians to, through the primary healthcare approach, to adopt healthier lifestyles so that we don't have to spend so much money on curative services such as the procurement of pharmaceuticals, but as needed, the resources have been made available for us to buy the pharmaceuticals, to buy the clinical supplies, so that the people who come to our health facilities get the care that they need as being provided by the public healthcare system in Namibia.
Very much. Mr. Nangombe, with that, we know that the ministry during the course of last year also, of course, described what you term a cumbersome procurement process. Perhaps you can just provide an update with that on that as well, please.
Yeah, we are working with the Ministry of Finance and Public Enterprises to make sure that the procurement processes through the Central Procurement Board are streamlined to ensure that when we submit our documents, they are processed on time. We are also working with the Ministry of Finance and Public Enterprises where necessary for us to obtain exemptions to be able to procure certain pharmaceuticals and clinical supplies pending the processing and the evaluation of the procurement bids that have been submitted to the Central Procurement Board. But as we know, Namibia being a country based on the rule of law, sometimes we have individual companies challenging perhaps the allocation of certain procurements to companies. Therefore, that tends to delay the process of the signing of contracts. But we have put in place mechanisms such as obtaining exemptions for us to continue to meet the demands of the country as far as pharmaceuticals and clinical supplies are concerned. So going forward, we believe that the situation is going to improve. We are seeing improvements already through the interventions that we have adopted, and we must work within the four corners of the laws and regulations of this country in order to just make sure that our people get the service that they need.